Hey guys, it's Jasmine and today I'm in the Cardiac Cath Lab and today I'm going to be teaching you about angina and how it's managed right here in the Cardiac Catheterization Lab. So angina is chest pain caused by myocardial ischemia, usually from coronary artery disease. Stable angina occurs with activity and improves with rest or nitroglycerin. Unstable angina occurs at rest, lasts longer, and is not relieved by nitroglycerin. This is part of acute coronary syndrome. Angina occurs when there's an imbalance between oxygen supply and oxygen demand. Coronary arteries narrow from atherosclerosis, which decreases the blood flow, which causes ischemia, which causes the chest pain. So we are going to prevent and promote health. We are going to focus on smoking cessation, low-fat diet, exercise, controlling diabetes and hypertension, and managing cholesterol to reduce angina and MI risk. So some major risk factors include hypertension, hyperlipidemia, diabetes, obesity, smoking, family history, advanced age, and sedentary lifestyles. So some expected findings would be chest pressure or squeezing, radiating pain to the jaw or arm, nausea, dyspnea, diaphoresis, anxiety, and elevated blood pressure or heart rate. So pain lasting longer than 15 minutes and unrelieved by nitro is unstable angina. Some labs that we're gonna do would be troponins. These are usually normal with angina but are monitored for ACS. Additional labs include CKMB, lipid panel, CMP for kidney function, and coagulation labs for the cath preparation. So some diagnostics we're going to see is an EKG may show ST depression or T wave inversion. The gold standard diagnostic tool is cardiac catheterization, which is performed here in the Cardiac Cath Lab. So some priorities that us nurses are going to include would be we're going to do mono. We're going to apply our oxygen. We're going to place them on a continuous EKG. We're going to establish IV access. We're going to assess chest pain. We're going to give medications, nitroglycerin, aspirin, and morphine if it's needed. We're going to prepare for cardiac cath if pain is persistent or unstable. So some medications we're going to focus on would be first is going to be nitroglycerin. It's going to dilate the veins and decreases oxygen demand. Aspirin, it prevents platelet aggregation. Beta blockers like metoprolol, we're going to decrease that heart rate and workload. Statins like atorvastatin is going to reduce cholesterol and the plaque progression. Heparin, give before or during the cath to prevent clots. So during the procedure, a catheter enters either the radial or femoral artery. Contrast dye is injected to visualize blockages. If a blockage is found, the cardiologist may perform angioplasty or place a stent. This is going to restore blood flow and this relieves that ischemia. But before we cath them, we're going to be NPO. We're going to have them sign some consent forms. We're going to check the kidney functions because of that contrast dye. We're going to go ahead and do some coagulation labs, see about any allergies, and then we're going to start an IV. After the cath, we're going to monitor vitals, as you can hear. We're going to do an EKG and assess site for bleeding or hematoma. So we're going to check our distal pulses, keep femoral legs straight if used, encourage fluids to clear contrast dye. So everyone a part of our care team would include the cardiologist, the cath lab nurse, the radiology tech, pharmacist, dietitian, and cardiac rehab. So some safety focuses would be we're going to focus on the iodine or shellfish allergy. We're going to monitor for bleeding at the access site, retroperitoneal bleeding after femoral cath, kidney injury from the contrast, and arrhythmia during or after the procedure. Some possible complications would include MI, dysrhythmias, arterial bleeding, or stent reocclusion, contrast, nephropathy, stroke, and infection. So what we're going to teach the client is we're going to teach them how to take nitroglycerin. We're going to do 1 tablet every 5 minutes for up to 3 times, and then we're going to call 911 if that is not relieved. We're going to do lifestyle modifications like our smoking cessation. We are going to go ahead and exercise, and we are going to have a low-fat diet. After the catheterization, we are going to have no heavy lifting. We're going to monitor the access site, and we're going to report chest pain or bleeding immediately. Okay, guys, I hope you learn more about what we do here in the Cardiac Cath Lab, and thank you for joining me here.